Joining me now, as promised, is New Hampshire Democratic Senator Maggie Hassan. Senator Hassan, I just played part of what you said today at the hearing, which was very powerful, part of what a number of your colleagues said today. But for people who weren't able to watch the full hearing today, you were in the room. What did I miss? And what should they really understand about what the Secretary of Health and Human Services had to say today about our public health?
Well, this is now the third or fourth time I have been in a hearing in which Secretary Kennedy has been the witness. And once again, he showed that he is a real danger to the health and safety of Americans all across this country. Excuse me. I actually hadn't seen all of the questioning, some of which you just showed. And what he did again and again and again is obfuscate, spin, lie, accuse other people of lying when, in fact, he was, to try to deflect. Excuse me. And what we really saw there was the reason that I voted against his confirmation and the reason that I, along with so many of my other colleagues, have called for his resignation.
One of the things, I just played this clip of what you said when you said that when he makes an accusation, it's kind of a confession. And I thought this was so astute because he's one of the people who should be projecting to the American public what they should know and understand about the health threats that are facing us. But he's not somebody who you can believe. But tell me more about what you meant by that when you said it.
Well, look, he obfuscates, he lies. You showed clip after clip, which showed him denying things that he said on TV, for instance. And then when you call him on it, he accuses you of doing what he's just done. And he's really projecting his own behavior onto people who are trying to get to the bottom of what's happened here. People are really concerned about the fact that he fired the new CDC director, somebody he had nominated and promoted for the appointment. When we called him on that or tried to get information about it, he accused her of being untrustworthy. When you present him with information that doesn't fit his narrative, he says you're making things up. And the thing here is that it is fine to question science. Questioning is foundational to science, and it's what leads us to better and better science, to the truth, ultimately. But that isn't what Secretary Kennedy is about. When he is presented with information that conflicts with his worldview, he just accuses whoever presents it to him of lying or doesn't accept the information as real. And he did that again and again today, even when, I presented to him the fact that there are multiple studies that say that the COVID-19 vaccine saved at least 3 million lives, American lives, and millions more around the globe. He dismissed that study. And I think that that's what you're hearing from the CDC leadership, the director who was fired, but the people who resigned in protest of her firing. According to them, they've offered to brief the secretary, but he wouldn't accept the briefing. And so, he accuses the Biden administration of not being transparent. And then when you ask him for the data that he used to unilaterally overrule scientists and change the FDA approvals for the COVID vaccines, he says he's presented it. He hasn't. It appears that there is no data that supports his view. But that's the problem here, and that's what I was trying to get at. This is a way he deflects and projects his own character onto the people who are challenging him.
It's such an important point. I had one of the former CDC high-level officials on last week, Dr. Demetrius, we call him, and he said they offered multiple times, and he wouldn't. And that's such a normal thing. These public health experts, they're not trying to be political. They're just trying to provide information. Let me ask you, when it comes to vaccine access, we talked about this a little bit last night. We're going to do a little bit more on it tonight. But we've seen some individual states take steps to ensure access is available through insurance. Unfortunately, that doesn't, of course, negate the actions of other states, like Florida, where they're making it harder to gain access and even getting rid of vaccine requirements for schools. We're really, I think, you tell me, at the front end of this in some ways in terms of seeing the impact. How are you thinking about the impact a year from now, 2 years from now, if these policies continue under this department?
Well, let's just take the Florida example for a minute. Florida's decision today is going to put more children at risk. And it's not just going to be children in Florida who are at risk. Viruses, illness doesn't stop at state borders. I come from the live free or die state. New Hampshire is very, very proud of our commitment to individual freedom, but we also believe in common sense. And we know some basic standards that protect all our kids, so all our kids can go to school without fear of getting a very serious or even in some cases deadly illness. That's just common sense. I am already hearing from people in other parts of the country, a mom who is under 65 years old. She has a child with type 1 diabetes. She always gets the COVID booster and flu shot together, so she is less likely to spread the disease to her child who has type 1 diabetes. And she was told in Montana that she can't get the shot even if she pays for it out of pocket. So it's already happening. These are really serious impacts. Families, especially families who have members with health conditions, make fairly sophisticated decisions in consultation with their doctors about what's best for them. And when I tried to say to Secretary Kennedy today, why are you taking this freedom away from families, from parents, about what's the right thing for them to do in their family? He just, again, told me that the vaccines are available and that there's no restrictions, which, of course, is exactly opposite of the new rules that he insisted that the FDA adopt.
Exactly. Senator Maggie Hassan, thank you for your tireless advocacy and truth-telling. Appreciate you being here. Okay, we're going to take